Hello friends, today we will discuss interpretation of synovial fluid aspiration. So what are the indications of synovial fluid aspiration? There are some consideration before aspiration of synovial fluid. If a patient present with monoarthritis of acute or chronic presentation, if there is trauma to a joint with having joint effusion, if a patient having monoarthritis with having history of chronic polyarthritis, and if we suspect a joint infection like septic arthritis, if we think it is a gout or pseudo gout arthritis or hemarthrosis. So for the joint fluid aspiration, what are the things we need to look for? We need to look for the appearance of the fluid, viscosity, WBC count, differential count, gram stain, Zn stain, culture, ADA for tubercular effusion, crystal deposition by polarized microscopy. But after aspiration, grossly we will have to look for macroscopically that it is hemorrhagic or not. If it is hemorrhagic, we can think it is due to trauma or mechanical dearrangement, or it may be due to hemoglobin coagulopathy, like patient may be a case of hemophilia. There may be a condition like neuropathic arthropathy can lead to hemorrhagic joint fluid effusion. But if it is not hemorrhagic, then we will have to think it is a inflammatory or non-inflammatory articular condition. For inflammatory condition, there will be high WBC count and neutrophilic leukocytosis may be present. So if the WBC count is more than 2000 and there is neutrophilic leukocytosis more than 75%, then, and if it is associated with some crystals by polarized microscopy, then it may be a gout or pseudo gout. But if there is no crystals, but there is high WBC count more than 2000 and neutrophil more than 75%, then we will have to think of infective or inflammatory cause. But if it is less than 2000 or more than 2000 but neutrophil less than 75%, then we can think it is a case of osteoarthritis, traumatic condition or other non-inflammatory condition. So if there is crystals, we know it is a gout or pseudo gout. If there is no crystals but there are features of inflammation like WBC count is high, neutrophil more than 75%, but there are no crystals, then we will have to do the gram stain, Zn stain and culture, and we will also have to do ADA. So if the WBC count is more than 50,000 per microliter, then most probable diagnosis is septic arthritis. But less than 50,000, then based on gram stain, Zn stain and culture, we will have to diagnose it. Most probably this is due to some infective cause or inflammatory condition. So this is all about evaluation of interpretation of synovial fluid. This is from the Harrison. Thanks for patient sharing.